A beautiful morning, beautiful afternoon, and beautiful evening to every one of you, my professional nurses, my subscribers. How are we all doing? How is preparation for your OSCE exam? Guys, I know you're really doing well, all right? So if you're meeting me for the first time, my name is Violet Okolocha. I talk about everything about OSCE and nursing here in the UK. So if this is what you want and if it's what you like, come on, sit back and let's do this to the end. All right, guys. So before I dive into vitral infusion phlebitis, it is really important, guys, to appreciate those who have passed their OSCE exam. Between the last 8 days I uploaded a video, I got over 60-70 messages of successes. I am super excited. I'm happy. Oh my god, welcome to your band 5ers, guys. I'm super excited for you. I'm super proud of you. More than the sky is definitely your limit. All right, guys, so today I'll be talking about vitral infusion phlebitis. The reason I'm talking about this video is because a lot of people have been having issues with this in their OSCE exam, so it is really important for me to tell you about it. Secondly, I want you to know all the types of cannulas that are also being used in your OSCE exam. So it is important you visit your royal medicine. All right, guys. So come with me and let's get started. All right. So before I dive into this topic, I want you to note some points I'll be telling you today. The first point I'll be telling you today is this cannula, never you flush this cannula in your OSCE exam from this site. If you flush from this side, it's going to be a fail. Now, many of us are not just seeing this cannula for the first time. We have been seeing it a lot of times. Can you take the camera, Aria? We have been seeing this a lot of times. But the only thing is, like, if you're practicing Nigeria, you were practicing in India, and before now you're practicing in, what do you call it, Filipino, you're practicing in Zimbabwe and the rest of them. You know, sometimes you may be flushing here in your country. But here in the UK, you are not allowed to flush from this place for the sake of your OSCE exam. You can only flush from this pod. I'm not supposed to be touching this pod like this. I hope you understand. I'm only touching it like this to explain it to you. You can only flush from this pod. So if you flush from this side on your exam day, it's going to lead to a fail. I hope we understand that. All right, guys. Now, if you look at this cannula, this is another cannula that is commonly being used in your OSCE exam. This one has 2 strings. 1 and 2. Some have 3 strings, 1, 2, and another string attached. So you can flush from any of the pots. You can flush from any of the puff. Now, some persons here, like, sometimes when I'm flushing, I face resistance. Now, if you face resistance when you're flushing with this cannula, just make sure you check that it is not locked. Now, come closer and make sure the camera is high, honey. If you come closer, you will see I've locked this. So if you are flushing, you will flush with so much effort, you will face resistance, and you can't flush because it won't go because it's locked. So check that it's not locked, then you take it this way. Another thing I would like to say is when you are attaching your posy flush to the pot, make sure you attach it using the aseptic non-touch techniques. All right, guys, so these are the commonly cannulas that are used in your OSCE exam. Make sure you don't flush from here. That's all, guys. Now, number 2 thing I like to tell you, if your assessor tells you, assume you've checked for scene safety, assume you've provided privacy, assume consent has been gained, what I expect of you is to do your hand hygiene. Failure to proceed to this without doing your hand hygiene can lead to a fail in your OSCE exam. Now, another thing that leads to fail is, I'll tell you this, and this is for all the stations. Now, if you are confirming a patient's identity and you are not looking at the document given to you, it can lead to a fail in your OSCE exam. Now, what do I mean? Come on, let's do this, son. Hello.
Hi.
My name is Violet and I'm one of the nurses looking after you. Can I please know your full name and date of birth?
My name is Eli Brook.
Perfect. And your date of birth, please?
14th February 1940.
Now, guys, look at this. I'm not looking at this paper. I'm just doing Eli Brook, date of birth, 15th February 1940, hospital number 100. Assessor, with the paperwork on my hand, I can confirm I have the right patient. Hello. No way. You have to double check with the document given to you, and you are double checking with the patient wristband. Guys, I really hope we're getting it. All right. So what I'm supposed to do, let's do this again, son. Hello.
Hi,
My name is Violet and I'm one of the nurses looking after you. Can I please confirm with you your full name and date of birth?
my name is Haley Brooke,
Perfect. And your date of birth?
19th February 1940.
That's fine. 19 February 1940. Hospital number 10010. I said so. With the paperwork of my hand, I can confirm I have the right patient. You saw what I did the second time? I was looking at the paperwork. I was looking at the patient wristband. So that's how it should be on your exam day. A lot of people just go there and you're not confirming here. I understand tension can make you do something like this, but that's why I'm bringing it to your knowledge again. All right, guys. Now, finally, before I perform this skill, I want to bring to your knowledge the fact that when your assessor tells you all your equipment is ready for use, all right, she tells you your equipment is all ready for use, just proceed to your patient. Please validate the equipment. If you don't validate your equipment in your Osce exam, it's going to lead to a fail. Now, what do I expect for you? She tells you all your equipment is ready for use. Of course, if you can see this is all ready for use. Do your hand hygiene. Complete hand hygiene according to WHO. Do it. After doing your hand hygiene, all right, I'm going to be validating my equipment. So you don't just feel because it's already for use, you just move over. No, please validate your equipment. You just pick up the alcohol swab. This is my alcohol swab. It's still valid. The expiry date is 2022. I'm happy to use intact and dry. That's it. So make sure you validate your equipment. Another vital point I want you to know is, during my online class, my students were saying to me, they did mention to me and they said, Violet, you clean the pot before attaching your pre-filled syringe or your post flush. Now, after flushing, you take off your post flush. Why do you clean again? That's what my students were asking me in the online class. So, and we clarified it amongst ourselves. And this is how we clarified it, how we all clarified it, the nurses there then. We said, during your implementation, if you look at the marking criteria for your implementation, nobody will tell you check for blood pressure before giving antihypertensive, or check for blood glucose before giving oral glycemic drug, that is your diabetic drug. It's not stated there. But then if you go to your Osce exam and you're doing implementation and you don't check a blood pressure before giving Ramipri, you're going to fail. Yeah, so I said to them, I would advise strongly that after administering your post flush, as you take out your post flush, I would advise you to clean your pod, but it's up to you. We'll follow the marking criteria strictly, however. So guys, let's get started on the skill. Now, before I get started, finally, I just have to remind you now, it is a mannequin. We all know that. So it is a mannequin hand that the cannula will be on. So because it is in the mannequin's hand, there is no redness, there is no swelling, there is no palpable venous cord. How do I know, guys? It's a mannequin. So obviously it's going to be a VIP of 0. Now the patient tells you they are having pain. You know, a VIP of 1 is either the patient is having pain or slight redness. One of them must be present. That's VIP of 1. Now you are still allowed to flush. However, while you are flushing the cannula, the patient tells you they are still in pain. Then you have to do what? You have to stop and recite the cannula. So now when you start, your examiner might tell you, assume you checked for scene safety, assume you provided privacy, assume consent has been gained. So I'll tell you how to go about it. So come guys, and make sure you share this video with your friends. It's really important. I remembered some of the emails I got 4 categorically said to me it was my first time watching your channel, and I'm grateful I watched that skill, because when I got into the Osce exam, I got a knowledge I wouldn't have gotten if I hadn't watched that video. So guys, I will really encourage you, share this video to your friends preparing for Osce exam. The aim of my channel is to make sure nurses pass their Osce exam at one sitting, and that's the aim. All right guys, so come with me and let's get started. So say to me, assume you've checked for scene safety, assume you've provided privacy, and assume consent has been gained.
Assume you checked for scene safety, assume you provided privacy, and assume consent have been gained.
Perfect. I'll do my hand hygiene according to World Health Organization. Palm to palm. Right palm over left bosom, vice versa. Fingers interlace, fingers interlock, fingers interlock. Rotation of the thumb, tips to the finger, and the wrist. So my hands are clean and I can proceed to my patient. Hello.
Hi.
My name is Violet. I'm one of the nurses looking after you today. Please, can I confirm with you your full name and date of birth?
My name is Haley Brooke.
And your date of birth, please.
14th February 1940.
Am I allowed to double check that with your wristband, please?
Okay.
So I have here Haley Brooks, date of birth 15th February 1940, hospital number 10010. Assessor, with the paperwork I have on my hand, I can confirm with you I have the right patient. Haley, can I confirm with you if you have any allergies at all?
No, I don't.
Perfect. So Haley, the said consent has been gained. However, I'm here to assess and flush your cannula. All right.
Okay.
So I can see your cannula site. I see there is no redness. I see there is no swelling. I see there is no inflammation. I see there is no, palpable venous cord. So I'm really happy to flush your cannula. So can you confirm with me? Are you having any pain near your cannula site?
No, I'm not.
Perfect. Now, what if the patient is having pain in their cannula site? So because she's not having any pain in her cannula site, this is a VIP of what? Of 0. Now, please say you are having pain. Are you having pain near your cannula site?
Yes, I am.
Oh, bless you. So if I ask you to score your pain, 0 being the least and 10 being the highest, what would you score?
Probably 5.
Oh, that's quite high. All right, so I'll be scoring your cannula a VIP of 1. The reason is because if there is any pain or redness, we have to give it a VIP of 1. However, I'm still happy to proceed to flush your cannula. All right.
Okay.
So when I'm flushing your cannula, if you've experienced any pain, it means I have to stop. I have to recite your cannula. All right.
All right.
Lovely. So I'll just leave you and I'll assemble my equipment. Use your call bell, please, if you need me. Is that all right?
Okay.
I'm just beside you anyway. Now, what am I going to do now? I'm going to read my prescription aloud. I have a prescription here for Haley Brooke, date of birth 15 February 1940, hospital number 10010. The date is today, the time is 10 o'clock, the drug is 0.9 sodium chloride, the dose is 10 ml, the route is IV, the prescriber signature is Ekuma, his blip number is 1234. This has been checked by my assessor. This is a legible prescription. This prescription is valid. I'm happy to administer. So assessor has told me that all my equipment are ready, so I don't obviously have to clean anything. Now we do my hand hygiene according to World Health Organization. Palm to palm, right palm over left bosom, vice versa. Fingers interlace, fingers interlock, rotation of the thumb, tips to the finger, and the wrist. Please, can you capture this tip? I just want it. So now I'm going to be validating my equipment. So I have here alcohol swab. The expiring date is 2023 September. This alcohol swab is valid, is intact. I'm happy to use. Now, this is my Posy flush. The expiry date is 2024. It is intact. It is valid. I'm happy to use. I pop it. All right. So since everything is all ready for my use, I'm going to be doing my hand hygiene now. Palm to palm, right palm over left bosom, vice versa. Fingers interlace, fingers interlock, rotation of the thumb, tips to the finger, and the wrist. I'll put on my apron. I'll put on my glove, then I will proceed to my patients. It's a very, very simple skill. So I'll take my tray to my patients. Hello.
Hi.
Mrs. Haley, I'm back.
Okay.
So are you still happy for us to proceed?
Yes.
So I have the right patients. I have the right dose. I have the right drug. It's going to the right route. The prescriber signature, everything is there. I've validated my equipment so I can confirm I've completed the right of medication. So Mrs. Haley, can I please confirm with you your name and date of birth, please?
My name is Haley Brooke.
Perfect. And your date of birth?
14th February 1940.
Perfect. And you don't have any allergies?
No, I don't.
All right, lovely. So I'm going to be flushing your cannula now. If you experience any pains while I'm flushing your cannula, please let me know. Is that okay?
All right.
Lovely. So the first thing I'm going to do is I'm going to be taking my clean air wipe. I've validated it already. I've taken the clean air wipe. This goes into the clinical waste, and I'll be cleaning my pots. I'll clean my pot for 30 seconds and I'll allow to dry for 30 seconds. So I'll be counting now. 1, 2, 3, 4, 5 is 30 seconds. This goes to the clinical waist and I'm allowed to dry for 30 seconds. After 30 seconds, I'll open my pre-filled syringe. This goes into the clinical waist. And sometimes you can find air bubble in your pre-filled syringe, but don't let it worry you. All you need to do is to take this off or loosen this gradually, and you push like this, and you're going to see the air bubbles going out. So this goes into the what? Into the clinical waist. So I'm going to be attaching my pre-filled syringe into the port of the cannula using the aseptic touch techniques. That is aseptic non-touch techniques. So I'm attaching this now to the puff of my cannula using the aseptic non-touch techniques. Make sure you roll it in, and when you roll it in, you are going to feel something like a click. So I've attached it. Now I'll be giving this pulsy flush or the normal saline in a non-stop techniques or in a pulsating action. Either you use non-stop techniques or using a pulsating action. So it's just pull and push. So watch me what I do now. So Mrs. Haley,
yes,
I'm just about flushing your cannula now. If you notice any pain when I'm flushing, can you let me know, please?
Okay.
Lovely. Can you come closer, my darling son? So now I will be flushing using a non-stop technique. You see? Push and start, push and start, push and start. Not that you just push everything once. So push and start, push and start, push and start, push and so I'll be flushing using a non-stop technique. Any pain?
Nope.
Oh, lovely. I'm happy to hear that. All right, that's all done for you, my lovely lady. This goes here into the what? Into the clinical waste. Now, I'll be taking my other cleaner wipe and I'll clean for what? For 30 seconds. 1, 2, 3, 4, 5. And I will allow to dry for 30 seconds. 1, 2, 3, 4, 5. This goes into the clinical waste. So what am I going to do? I'll take off my apron. And I'll take off my glove. And it all goes here. It all goes into the wall. Into the clinical waste. I'll do my hand hygiene quickly. And I will sign. Don't forget to sign in the exam day. As nurses, anything not charted, anything not signed is not done. So I'll sign. You can sign with your signature if you like. You can sign with your initials if you like. Guys, it's strictly up to you. Alright? So after signing, Mrs. Haley, thank you so much for your cooperation. Alright?
Okay.
So your cannula is still patent. Alright?
Alright.
So I'll do my hand hygiene. Make sure I clean all my equipment ready for the next use. So guys, thank you so much for watching. Don't forget to share your video. Don't forget to share this video with your friends who are preparing for Osce exam. Don't forget to give this video a like. Don't forget to give this video. Don't forget to subscribe. And I'll see you in my next video on wound assessment. And until then, keep passing your Osce exam, guys. I love you all. Bye.